Hey, what up, Doc? This is John, and in today's video I'm going to be showing you how I go about editing my photos. And the software that I'm using is Lightroom Classic. We use Smile Virtual, which is a telecommunications platform for dentists. But essentially what happens is we get our potential new patients from Instagram, YouTube, and what they do is submit a smiling photo. Dr. Pierce will send basically a virtual consultation or a virtual exam and say, this is what you need, this is how much it's going to cost. So by the time they come into the practice, there's like an 80% close rate with cases. So basically when they come in, the Dr. Pierce will introduce himself, and then he'll say, we're going to take some photos, do a scan with the iTero machine. And that's when I come in and I take the photos in basically a studio. I don't know if you want to call it professional, but I got constant lights and things like that. And then I go back and I edit them. When I'm finished, I let him know. Then he goes back in there. It takes about 5 minutes, and I'm basically going to walk you through what I do when I'm editing. So what I'm doing is a quick edit. Okay. Later on, when I'm doing like befores and afters on Canva, so that I can use it for social media, I'll go a little bit more in depth with the color correction and things like that. Okay, so these are the photos that I'm getting. It's just 8 photos that I take. I usually probably take about 12 photos, but I kind of deleted them out of here so I wouldn't confuse anybody. So the first shot that I'm going to be correcting is the smiling shot. Okay, now a lot of dentists might say that, hey, the first thing to do is get your composition correct, get it framed up so you don't have to edit it and post. But in my experience, which I've been doing this for about 12 years now, it's not that easy. First thing we're going to do here is crop the image. Okay, that's every photo that I take, that I edit, I always crop first. Okay, now what I'm going to do is bring this down and then put the teeth center of the mouth. And then I'm probably going to cant it a little bit. See these spaces here on the sides? I want to close those up, so I'm going to probably make the smile a little bit bigger. Now these lines, these vertical lines, I try to keep the laterals in those lines so that every photo that I take is basically the same. Now I took all these photos in raw images, so what happens is Lightroom Classic usually will color correct for me, and it's pretty nice because when I'm crunched for time, it gives me less work. I'm going to reduce the noise because my camera does have some noise because my lens it's a Tamron 28 to 75, and I'm always taking shots at 75 millimeters. So I'm going to reduce the noise there. I'm going to remove the chromatic aberrations and the profile correction. I always tend to brighten up these photos just a little bit if they're too dark. Everybody's skin tone is going to give me a lighter or darker image. Now when you take a picture in RAW, it gives you that flexibility of going lighter or darker without basically ruining the image quality. And I do a 2:1 aspect ratio because when I go to edit the photo in Canva, it's going to be a perfect square. The side shot here. Now when I initially imported these photos into Lightroom Classic, it was a very sterile photo. But like I said before, Photoshop does its magic. Does its AI auto correction, their color correction, and so I don't have to really do that. Once I hit the button, the tab develop, it automatically does it for me. So let's go to develop. I want to go again to 2.1, and I'm going to bring it down. And I'm kind of back and forth of how I line these up. I typically go for about the first third line, right between the centrals, right on the midline, like that. And then all you gotta do is hit that. And again, I'm going to reduce the noise. And what I've been doing lately is increasing the clarity so that it pops out a little bit more. And I'll put it on the second tab on Instagram because I'm primarily using these photos for Instagram. Let me go back to this first one and bump that one up too. Okay, where's the clarity? Right there. Okay, so let's go back to the library. Okay. Alright, I'm not going to go into this one because I already showed you how to do it. What I'm going to do is go to this Intraoral here. Again, this is going to be I want to close it down, and you don't want these cage retractors in the photo, so I want to take it down quite a bit. Now this is a full frame camera. If you're using an iPhone or a regular crop sensor camera, which is just a smaller sensor that's in the camera, it's usually typically around $500 for the camera. You're not going to be able to crop down as much because it's going to ruin the clarity. Okay, so now one thing that I noticed about this photo is it looks a little sterile and a little blue, and I want to brighten it up to make it pop out. Now you don't have to necessarily do this for like presenting these photos to a patient for in the exam, but I would do it for the final post, for the final edit, so that you can make it look good for Instagram. So what I'm going to do is make it a little warmer. That usually brings a little bit of life to it. It makes it more realistic. Okay, and again, I want to, let's see, bring up the clarity, and then I will bring the noise down, take out the distortion of the camera, and then make it pop out like that, just like that. Now, it's very important that when you're taking photos in dental photography that you have the same environment so that nothing changes as far as auto white balancing, or I'm sorry, white balance or shadows and things like that. So whenever I take photos, the chair is always in the same position, which I highly recommend that you get a stool and not a swivel chair because it doesn't move around as much, and you want to make sure that it doesn't have a back, because patients tend to lean against the back of the chair, and it makes them gives them poor posture. Okay. Oh, and let's get to this photo because I know that a lot of you are interested in these contrast photos because this is kind of hot on Instagram right now. So let's do that. I'm going to crop it, and again I'm going to bring it down. Now, you're not, on every one of these photos, everybody's different, so you're not going to get the a good shot every single time, so you might miss out on the posterior teeth a little bit, but that's kind of one of the downsides of doing this. So if they bite down on this, what's going to happen is there's going to be a glare right here you'll see it on the basically mimicking the arch, and that's what you don't want because you can't really get rid of that unless you do a lot of editing, and I try not to do that. So what I do is I just have the retractors far away from the contraster, and I just have them open and I rest it right on so it's kind of angled down so that you can't get any light reflection. Okay, so here we are again. As you can see, it looks kind of sterile. I want to warm it up, bring some life into it. All right, and this is more realistic to what I actually see. Okay, I'm probably not going to bring up the light because I don't think I need it. And then I'll go down here and I'll reduce the noise again, and I'll take out the aberrations and the lens correction there. Okay, so that's all I need to do. Now, not every photo is going to go that easy. Okay, and I'll go into another example later on down the road where I need to do more extensive editing. But this, like again, this is just for an exam. So my objective is to get it up so that the patient can view it with the doctor as soon as possible. Okay, and then the portrait shot. Now, if I was using a flash system, now this is the main reason why I don't like using a flash system with cameras, is because if I were to take a picture with the flash on, what it's going to do is, you might have seen other dentists take this photo, there's going to be a ring of darkness behind them, and it just looks very cheap, very amateur, and it doesn't look good. Now, one way to avoid that is to get constant lighting. Okay, so there's no overpowering flash. Okay, so to edit this, I'm going to crop it. This time it's going to be a 16:9. 16:9, if you don't know, is the aspect ratio for an iPhone. I'm not sure about Android because I don't use an Android. But basically what I'm going to be doing here is lining up this third line and with her eyes. And I'm going to reduce it so that just the tip of her shoulder seam is hitting the sides of the frame. And that's all you got to do there. And again, I'm going to reduce the noise. Alright, I'm going to correct the camera a little bit. And then one thing that you might have to do is, if they have a lot of acne or they're taking Accutane and their skin's real dry and their lips are peeling, you want to go in there and edit that out, because people don't want to see their skin when it looks bad. So what you can do is just go to this heal button. All right, and just make sure that's on heal. And what you can do is just zap these little kind of moles or anything. And some people actually don't even want to see their photo up on the TV being analyzed in front of people. So that's another thing, but that's another video down the road. And there we go. So that's basically all we're going to do. The objective when editing photos is to get the color of the tissue correct and the skin complexion, so that way your photos look consistent and it looks professional. So that's all I have for this video. If you have any comments, please leave them in the comment section below. Let's get talking about this. If you have a different technique of editing, let me know. Let everybody else know. This is for you guys. So until next time, I will see you in the next video.